Presenting a case of female 50 who come to us with watering and abscess on the left medial canthus. And antibiotic was given for 5 days, then patient taken for the OT. And we have opened the sac like book, and posterior flap just wrap on the posterior anterior flap cut completely. You can see common canaliculus in the lateral wall of the sac. You can see movement of the lateral wall of the sac. So this sac is completely open after given antibiotic. This is the case of revision DSR. Previous DSR surgery endoscopic done, I think, 10 year back. So this is the revision case of endoscopic Dcr rhinostomy, and this sac is thin because of previous surgery and open like book. You can see common canaliculus and inflammation inside the sac. So this is a revision case of endoscopic Dcr rhinostomy, and this case done at Rajasthan Hospital Shaibag today. So you can see even revision cases you can do endoscopic DCR. So, what are the difficulties in revision endoscopic DCR? First difficulty will be scar tissue in fibrosis. It is the most common cause of difficulty. Having dense scarring obscure anatomical landmark, making mucosal flap elevation very challenging and difficult to identify lacrimal sac boundaries. Second challenge will be inadequate previous osteotomy. There is osteotomy may be too small. Third one is failure of identify lacrimal sac because of mucosal growth, granular tissue, excessive fibrosis, or incorrect initial site of injury. Fourth is common canalicular stenosis or obstruction. There may be because of probing, dye test, or endoscopic canalicular evaluation may lead to this stenosis. Fifth one is granulation tissue formation that may lead to bleed heavily and can re-obstruct the opening. Sixth one is middle terminate lateralization or synechia formation also may obscure the sac. Seventh may be anatomical distortion after previous surgery, thickened bone, osteogenesis, or shifted anatomical landmark. Eighth one may be narrow surgical field because of deviated nasal septum, concavulosa, or previous surgery adhesions. So these are the risks during revision endoscopic DCR.